Ladies and gentlemen, good morning. I would like to welcome you all to this very important event, to the Ministry of Health, and equally important to the nation at large. Because this event, it kickstarts the verification of NHIF assets and liabilities, and this is to ensure that we have an effective transition to social health authority. This verification is in line with the government's commitment to ensure a seamless transition from NHIF to SHA, one that does not disrupt service delivery to the people of Kenya. As I have said many times before, and I would like to repeat, that this transition will only say it is seamless when the public do not notice any change. They should not even realize that there has been a handshake between NHIF and SHA, except at the point that we have improved service delivery. So this verification, as it has been said earlier, is that it wants to ascertain the liabilities and assets held by NHIF at the headquarters here in Nairobi, at the regional offices, at the branches, and even the satellite. And I'm told that we have some offices even in Huduma centers. So that is also going to be verified. And at the end of the day, what has been verified is what will be handed over to SHA. And at this point, I would like to clarify to Kenyans that the team, from the brief I have received this morning, has done an excellent job in preparing for this exercise. And therefore, the expectation is that the transition is going to be smooth, it is going to be accountable, it is going to be transparent. I want to ask of the teams that we commit ourselves maximally to this verification exercise, but also request that we work within the timeline that we have. We did gazette the transition committee towards the end of November, and we had a very strict timeline, because our expectation is that from the 1st of July, SHA must be providing services to Kenyans. So for the team that is going to go out, please note that we have strict timelines, but that does not mean that you do the wrong thing. It only means that now you have to be extra cautious, be extra careful, so that then you do a good job within the timeline that we have. As a ministry, we have committed that from the 1st of July, indeed, Kenyans shall be accessing services from Social Health Authority. So we anticipate that immediately this month, we will begin household registration. And while this is happening, I want to assure Kenyans that NHIF is still up and running to provide services. So people should not be worried. Kenyans should not be worried. Service providers should not be worried. Services are going to continue even during this exercise. I want to urge the service providers and the facilities to continue providing services. You will recall that early this month, we did indicate that as a ministry, we had received resources towards payment of verified claims for NHIF, and that includes Linda Mama. So we expect then that the facilities should continue to provide services based on the funds that they have received. And we shall continue to pay and settle all claims so long as they have been reconciled, verified, and they are legitimate. Then we shall continue to pay. But also to ask the service providers, do not deny Kenyans services. Especially now when we have come out of a crisis, when there was a gap in service delivery, due to the doctor's strike. Let us go all out to ensure that we provide the much needed critical services to Kenyans. Let me appreciate Chair Kapkiro with your team, Transition Committee, and the experts that have been drawn from National Treasury and Economic Planning, from the Ministry. I'm told we also have experts from Ministry of Lands, Public Works, Housing and Urban Development. We have experts from the Ministry of ICT and Digital Economy. And to thank you all for dedicating your time to this crucial exercise. As you are aware, we are committed to delivering universal health coverage. And we all know that the government has so far enacted the four acts that are going to ensure that we have proper health financing to achieve universal health coverage. And for those who may not have known, that now we have three funds: the Primary Health Care Fund, the Social Health Insurance Fund, the Emergency, Chronic and Critical Illness Fund, and all these are under the umbrella of Social Health Authority. I know a number of news reporters and some Kenyans have been asking what is the difference between SHA and Shif. SHA is the umbrella body, Social Health Authority. Under Social Health Authority, we have the three funds. One, the Primary Healthcare Fund, that will ensure Kenyans can access services at the lower levels of service, primary healthcare. Two is the Social Health Insurance Fund, Shif, that will ensure that then Kenyans access secondary services, level 4, level 5. Then we have the ECCIF, the Chronic and Critical Illness Fund, that then ensures Kenyans can access services at the tertiary levels, that is level 6. So I thought I needed to make that clarity so that people know the difference between SHA and Shif. In simpler words, Shif is a baby of SHA, if that makes it simple for understanding. I also want to thank Engineer Kamau and your team for the dedication and the management, for the support you have provided to the team. I know the Transitional Committee has been asking for documents here and there. They have been talking to the staff and management of NHIF, and I want to thank you for the cooperation so far and ask that we continue to cooperate as we bring this to an end. I want to ask each one of us to also play our individual role to ensure that indeed the transition is seamless as we have planned, and this will facilitate timely transfer and initiation of services provision by Social Health Authority. And all this is to ensure that we achieve universal health coverage. I do not have much to say, but to tell the teams that you have our blessings to go out and do the right job, as it has been said. Ensure you have seen. If possible, ensure you have touched and confirmed that if the vehicle is KBY 001, then it is indeed KBY 001. That if we say the land is 1 acre, then it is 1 acre. It is not 0.9 or 99. Please. And I want us to do this based on the process that has been established, because we are living in a country where there's a trust deficiency on each and everything that is done. We now have people who are critical of anything. Even this meeting, someone will ask, why did you have to do it? So let us follow the process, that in future we can go back and explain how we have arrived at what we have done. But equally, I hope that by the launch this morning, it also gives comfort to Kenyans, and especially the service providers who had thought that probably the obligations by NHIF will not be met. I hope this morning we give them a level of comfort that once it is verified, then it is a liability that moves to Social Health Authority. If it is a claim, it is verified, then you know that the claim moves over to Social Health Authority to be able to make the payments or to be able to meet its obligations. Asanteni sana. God bless you all. And as you go out, please exercise due caution and care, especially when we have some rough weather. Do not insist that we have to cross the river to count the assets on the other side. Exercise due caution. Asanteni sana. God bless you.